Welcome to another episode in our Destination Rural podcast series. I'm Peter Rutherford. I'm the Chief Executive Officer at the Rural Doctors Association of Australia. And I'm excited to be talking today to Dr Aaron Hawkins from Tassie. He's a recent fellow and also a practice owner, so some really interesting perspectives. Thanks for joining me, Aaron. And just let's start something really easy. Where are you working? And where are you up to in your training or career pathway?
Oh, thanks for having me, Peter. All right, so I'm working in Deloraine in Tasmania in general practice in the district hospital we got here. And where am I at in my training and career? So finished acrim training 2 years ago now, and now just, I suppose, finding my feet, what I want to do really long term, how I want to balance 10 different jobs, which is what it ends up feeling like being, and trying to work out how to split up my week and balance that with the family. That's what I'm spending my time thinking about trying to work out now.
So are you a Tassie local, or are you from the mainland, or where are you from?
Originally from Queensland, so grew up there since I was 6 or 7, and then did uni at UQ and spent a couple of years at Logan Hospital in Brisbane, near Brisbane, and then moved to Tasmania, just kind of initially as a gap year, and then as a gap 4 years to do acrim training, and then sort of fell in love and had a kid and bought a house, and then now I'm sort of here forever. You know, how those things end up.
So, obviously rural generalism in Queensland's been around for quite a while and sort of has just started to, become something of significance in Tassie. Was that the sort of training pathway you were always thinking, or were you thinking of something different? And if you were thinking of something different, what made you end up choosing rural generalism?
I definitely wasn't thinking it all the time. And if you had told me, like, I just grew up in the city, it had nothing to do with rural medicine when I was younger or anything like that. So it would shock younger Aaron to see what I've chosen as my career and where I'm living and all of that. I think, I don't want to be a cliche, but I went and did a rural term at Oakey with John Hall, and he was just so passionate and excitable and all of those things. And I really liked it. But even I came back from that rural term, I still wouldn't have expected to have decided this on a career. And then it basically was sort of just trying to work out, I couldn't decide what I wanted to do in my first couple of years as a junior doctor. I wanted to do mental health or psychiatry. I wanted to do sort of physician training. But also I'd always sort of just imagined general practice as well. Like that was sort of how I maybe in my head imagined my career. So really I kind of just picked it because I wanted to do the combination of all of those things. I really liked the idea of the advanced skill. And I did mental health for that. So that kind of felt like I was bridging some gap between all of the things I wanted to do. And also, as I said, I sort of wanted to come down to Tasmania. I'd grown up in Queensland, through the medical system there. So, rural generalism was like a huge, well-established thing. I actually wasn't necessarily aware of it not being as established in Tasmania when I moved down. I just thought everywhere was like Queensland. And so I came down and I thought, oh, that's a great way. I'll go down there for a while, do the training, potentially move back to Queensland eventually or something like that. And so, yeah, sort of just fell into it and then loved it. And as I said, sort of stayed down here. And since I've arrived, rural generalism in Tasmania has exploded, and it's really good and exciting. So yeah, it was just timing. I just fell into it, really.
Nice. And you mentioned John Hall, and I mean, I dare say he's converted many a city of folk to rural medicine, or at least put it on the radar. What about other mentors? Have you had, people, whether through your training program or sort of more senior mentors that have influenced you as well? And how important is that?
I think I mean, it's so important, or it's at least so like, I think it's a common story for that to really shape people's decisions about their careers. If you work with somebody that's really inspiring or that really seems to be happy in their job, then that way more than actually, I think, the medicine or the decision, the actual day-to-day job is what seems to drive people. And that's definitely been my experience. I think if I think about like mentors through my training and then more recently, I kind of think of my career in like different sections, I guess. So I've had different mentors or people that have sort of supported me or made me excited for my job in the different areas. So like John Hall was really early, and then that was when I was a student, obviously, and then I didn't have much contact with him until much more recently through RDA. So he was a role model, but the people that sort of mentored me were kind of just closer. I just happened to fall into a really great practice at Smithton when I came down to Tasmania. That's a town on the far west coast. And there were a couple of GPs there that'd been around forever, very different to John Hall, like they like almost like I can't describe them as being more different than John Hall when I think about it, but that they kind of just got me to really understand how rewarding it can be as a career in general practice. And so that was like in the general practice rural kind of setting. And then the sort of in my more like the mental health and other aspects there, that's been a bit harder. I haven't had a really clear pathway and a mentor with that, but some of the psychiatrists I've worked with down here, I still work with now, and that's been like really great, actually, not just in the psychiatry bit, but the psychiatrists are really good at sitting down and sort of talking straight to you about what you are good at and what you're not good at and things like that. And so that was a turning point with me and my training, actually, when one of them sat down and said, look, you're a good registrar, you're really hardworking, and you're actually at a point in your career when you need to think about not being a junior doctor, be a leader, because and that was like nobody had ever said that, and nobody I don't know, it's just like a really crucial piece of advice at a really important time. I was like just about to go into my last year of training, and it's like stuck with me ever since then. And I think only a psychiatrist can really sit down and look at you and think, okay, what do you need to hear at this right moment? And so that's then like just catapulted me really just to think about my career in a different way now and shift like that. So that's been fantastic. And then I think, the other aspect of the interesting stuff I've been doing the last few years has been like with actually RDAT and some of the advocacy stuff, which is a totally different skill and a different thing to be learning. And somebody that really helped me or encouraged me or was like really supportive early on then was Dennis Passion. And, I only knew Dennis in the last 18 months of his life. And I'm sure I'm not the only one to think what a tragedy it is we didn't have more time there. But he was like, and he and I were never super close, but in that way, in that advocacy part, he was just so supportive and so encouraging of like, this is the sort of next generation coming through. This is how you do it. And he said it straight. This is how you do it. This is how you not do it. This is what you got to say. So, like that's really
I'm sure
like
there are a few expletives thrown in as well.
Exactly. So yeah.
With the mental health, because the mental health advanced skill is one that we don't hear a lot of. Like a lot of people are doing anesthetics or obstetrics, and I guess is it something that you had an interest in early in your career, but are you using it sort of in a like every consultation, or is it something that you've set up a clinic around? Like how do you provide that service to your community?
I kind of think of it in two parts. I think the advanced skill itself is clearly really useful for all of general practice. Like more mental health experience is really great, but and so I do use that in like every consultation and all my normal mental health. But I have tried to work out how that sits, and as you say, it like doesn't have a clear pathway. It hasn't been there's not a clear defined role for it yet. And so there's two ways that I do it at the moment. I set aside a whole clinic in my private general practice. So one day a week, I have longer appointments, and some of those are for my own patients that I bring back for those appointments. Some of them are the other doctors in our practice locally that send a patient to me for advice and an assessment, and I send them back. And that works really well, sort of setting that time aside in general practice so that I make sure that I'm not just overrun with ordinary general practice chronic disease stuff, and I sort of specially put aside time for that. So that is really good, but it's hard to, I don't know, it's just hard to set up something new in the practice, and there's been bumps and lumps along the way. But and then the other thing that I do is I spend a day a week in the community mental health for the public system, which has been a really good opportunity with some funding for a trial in Tasmania, which has been good. So that position sort of sits with its own money for it, and it means I've been able to shape it and design it and work out what it's doing. So that's been really exciting. And what I do there is, so the public referrals that come in from GPs in the area that usually wouldn't meet the criteria to be seen publicly. So everywhere's obviously different with their criteria, but I think a lot of places experience the problem where if you're not acutely suicidal or acutely at risk or acutely psychotic, then basically your referral gets bounced back from the public system and you just can't be seen. And so those referrals that would normally get bounced back, then they come to me, and either if they're relatively simple, it might be that I actually just don't even see the patient. I talk to the GP and give them advice and work through the case like that. Or then the vast majority of patients, then I try to do like model it on the 291 psychiatry assessment kind of thing. So do a thorough, comprehensive, single one-off assessment and then send a management plan back to their GP.
And in Tassie, my understanding is that there's really not much mental health service outside of Hobart, and then is it Devonport and that, or is it Hobart itself?
So we do have regional public mental health services. So there's Hobart and then Launceston and then the Northwest, which is Devonport and Burnie. Okay. And so they are great. They're just like probably the rest of Australia. They're under the pump and really difficult to service the amount of work that's coming in. So that means that they are really tied up in the higher acuity mental health and really struggle with supporting GPs with the sort of depression and anxiety of the more complex end. And some of the really difficult ones are things like when that's got intellectual disability or other comorbidities that make those kind of cases really, really complex. But there's not much support publicly for those in the system.
Yeah. Okay. It's I guess you'll be watching them with interest what we do with the RG and the MBS item review. So
absolutely. Yeah.
Stay tuned.
Yeah.
You mentioned before that you've got a young child. So how old? Son, daughter?
I've got a son that's 4 and a daughter that's 2.
Okay. And you're like, is the community like, are you there for the long term? And what does your partner do?
My partner's a vet and she works for the state government down here in Tasmania. So she's like a sort of the equivalent of a public health doctor in the public health veterinary.
Does she do big animals as well as little animals?
Yes.
I'm not telling Inika because she'll try and recruit her to Kuma.
But then, so then like we live in Deloraine and my kids go to the daycare here and the primary school. But the 4-year-old has just started in kinder. So that's sort of the plan, and now like long term, seeing ourselves here, it's been a great place that sort of that's been what's driven us to think, okay, well, where do we actually want to stay and settle down, and this at least for the foreseeable future while they're younger and going through school and things like that. That's hopefully the plan.
And how, like with Deloraine, how is it for things like childcare and schooling? Because that's often something we hear that people have reservations about going rural because of those limitations. So how is it down there for that?
So childcare is so we've got a like amazing childcare that's this not-for-profit, really nice one that's like got a great feel. We were lucky and sort of got in at a good time. It's not always easy to get into, but it's not impossible either.
Yeah.
So like there's a wait list now and things like that, but still really, really good there. Then the primary schools are quite good. There's a Catholic private primary school and then a public primary school and secondary school. Um, but Deloraine's kind of lucky, and even all through Tasmania, everywhere's like kind of close enough that I think for high school, we'll probably send our kids into Launceston, which is 45 minutes to an hour away. That's a sort of regional centre town that has sort of good schools, but close enough for us to get to easily. So that's good. I think we're pretty lucky with what we've got accessible for us in
So they
Deloraine.
probably wouldn't be, if they were catching a bus or something, they wouldn't be spending any longer on transport than what they would be if you lived in a
The
capital
middle of Sydney.
city.
Yeah, exactly.
Yeah,
Exactly.
nice. And what are your interests outside of work? Like, do you do sport? Do you have, you know, musical interests, anything like that?
They've changed through the years and they've had to change since I've had kids. So I used to really like hiking and I still really like hiking and try to do that a lot, but that's been heaps harder since I've had a 2-year-old and a 4-year-old. So I really haven't been doing as much of that as when we first moved down to Tasmania. Now, we've in Deloraine, we've set ourselves up with a really nice garden that we're trying to learn how to do and work with. So I am trying to learn how to have a tiny little apple orchard that is setting up at the moment, and then a few other things around here. Again, I moved from Queensland. I used to play touch footy and a big South Sydney rugby league fan, but nobody's ever
Oh,
heard of
you're
rugby
killing
league
me.
down here. And there's certainly no just social touch footy teams down here unless I want to learn how to play Oztag. So the now I play squash, really making myself feel like an old man. But yeah, trying to get into new things now that we're down in Tasmania and there's no prospect of any touch teams on the horizon down here.
You have to convert to AFL.
Yeah, I know. Geez.
Too far. Too far. So with with that, I guess, we talk a lot about work-life balance and, trying to fit it all in. And I guess, how important is that? And obviously having the other interests to maintaining, a really sort of positive career in rural medicine.
It is so important and so hard. Like, I feel like this takes up so much of my thinking time is how do I structure my week and balance my time and things. And like, I don't think there's a perfect way. And I also, the more I think it through, it just looks different as life goes on too. Little kids, family, other hobby, as things change all the time. But that balance I've had right and wrong at different points over the last few years. And it's really, really hard when you don't have that balance right. I think like you get totally overwhelmed with the endless general practice and hospital work and being on call. And it just feels like you can start drowning if you're not careful because it just, it will suck you in. And the more that you want to do, the more that there's work lining up for you. So that's been really hard. And especially once then you throw in other things that I find really fulfilling, but also can easily take up all your time as well, like the advocacy things, like working with RDAT, like then trying to see what mental health and how that fits in. And then recently I've been able to become a part owner of the practice. So you've got this whole other like non-medical things to learn. And basically, if you're not careful, your whole every waking moment is taken up by that. So I mean, the way I try really hard to protect most of my Mondays, which means that Tuesday to Friday is like really, really full on and busy. But that if I've got that day at home and my wife also has that day off, which is really nice. So while we've got young kids, then we have that really quality time every week. And then I think as long as you've got that mental space, then I can deal with 4 really full-on days with an on-call and travel and all the other things and like that, as long as you protect that time. and if I didn't protect that time, it gets stolen by all the things I want to do really easily. So I have to be really careful with that.
Yeah. And with, I guess, your training in that, and you're not that long fellowed that you've forgotten what that experience was like. What, going through the training years as an ACRM registrar, what were the interesting bits? Like, what were the surprising bits that you found within training as a registrar?
Um, the interesting bits. So I did training with GPTT before the like transition to college-led training. So that was good. They were quite supportive, although I think um, the the number of ACRM registrars compared to RACGP registrars was very low, and so a lot of the training was focused away from ACRM and things like that. So that was a great training experience through them, but also it was quite good. I became a registrar liaison officer then, and so I sort of had this good opportunity of working out how we can make the training program and GPTT and the whole system a bit more supportive for ACRM registrars. So that was like a really nice role that led me to get to know the ACRM registrars and the training and other things like that a lot more. So I really, really liked that in my training. That made me feel really part of the whole training program rather than just like a cog in the wheel and working through exams and stuff like that. And that led me to then now I'm a medical educator with ACRM, and like it opened a lot of doors like that for me too. So I really liked that in my training and found that really rewarding too. Again, that's just another thing on the list of things that you can easily take away your work-life balance with it. But yeah, I really liked that. That was a really interesting part of my training. Other sort of interesting parts was shifting. So I did 1 year of general practice rurally at Smithton, like I mentioned. And then I went back into the hospital system and worked as a psych reg for my AST, and then back into general practice after that. And that was a good experience, like just sort of shifting in and out of what I found, what I liked in my life and what I liked, what was sort of the advantages and disadvantages of the big system in a big public hospital versus the small little private business practice. Both of them have really good advantages and disadvantages. But yeah, that was nice to sort of have that experience through training and then now be working where I am.
And now you're a full grown up, and well, you mentioned before that you've bought into the practice, which is unusual now because we hear a lot about young doctors, not wanting to buy into a practice, and we talk about, easy entry, gracious exit out. But you've obviously bucked that trend, and so what attracted you to buy into the practice, and just sort of some of those influences and what you hope that will give you longer term.
Yeah, again, like a lot of the good things that have happened in my career, I just sort of fell into it at the right time, and it was a good sort of opportunity at the practice that I finished my training and then stayed on as a fellow. So when I was buying in there, I sort of had in my head, there's a great opportunity to have a bit more control over the practice and how the medicine looked and what we can do for the community and our relationship with the hospital and all of these things that I thought, okay, this is great. We're going to make all these changes. And actually then when I started as a part business owner, I realized just how different all of those HR and business skills are to medicine. Like it is, that seems obvious. And I knew that if you had have asked me before I went in, I was like, oh yeah, of course it's different skills and stuff like that. But it is so different. It is so different to anything I've ever done, which has been so good. It's been really nice to have a totally different skill to be learning outside of medicine and working out what that means and what it's given me an appreciation for why things aren't very easy to change sometimes. All of those great, brilliant ideas that I had before I started as a practice owner, they're not as easy to build in. And working with doctors, I think nobody would be surprised to hear doctors are never particularly easy to work with in terms of what they want in their careers and things like that. So trying to sort of make sure we keep in mind, how do we look after the doctors that are here with us and make them happy and fulfilled in their careers. It's different for every single person. And so that's been like an amazing experience, really, really cool to try and think all of that through. And I've been really lucky. A couple of the other owners, one's a really, really experienced GP who's been around forever and been all around Australia and stuff. So he's been great in that sense. And then one of the other practice owners he's not a doctor, his background's a practice manager and in business and stuff like that. So that has been really good to sort of, open my eyes and work with that really hard, brand new kind of skill of that.
And is it something that scared you, or you thought was more of an opportunity?
Kind of scared me financially, like not as in the thing that scared me is the knowledge of how quickly a practice can go under, I guess. That I've seen that happen around Tasmania, and that it happened to some degree in Smithton just before I left or just after I left. And just a practice, I know that a practice can go from being in a really great place to being unable to keep above water very quickly. You just have to have a few dominoes fall and things fall apart. And so that did and still does scare me in some ways. But no, I think we sort of made the decision, okay, this is a great place for us as our family to be. And so I really want to have the practice that I'm working in and be part of the decision making there. And that's really the reason that we went down that line. And it's now been 12 months or more, and it's been exactly as I sort of thought. It's been really rewarding from that point of view.
Nice to hear. This will be an interesting thing, I guess, insight to you. What's the best piece of advice you've ever been given? Although I think you've already mentioned that from the psychiatrist. So maybe about a piece of advice that you would pass on to medical students or junior doctors coming through.
Yeah, that's good. You're right. I have mentioned that. That would be the best advice I ever was given. So advice that I would give to junior doctors. So one thing would be that my experience was there is really no rush in deciding what you want to do. And that the longer that you wait, I think the more comfortable you're going to be with your decision. So I didn't really know what I wanted to do all the way into my second or third year of as a junior doctor. So that led me lots of different experiences and sort of meant that when I finally made a decision, I felt like I'd tried different things and gone down different pathways and was really comfortable with that. And then the other piece of advice would be that I think I have been really lucky. I've fallen into some really great jobs, but it's also, I think the more you can be sort of enthusiastic and say yes to things, then it just opens up the next door and the next door and the next door. And I've been really rewarded when I say yes to one thing and excitedly sort of pursue it, then it opens up the next door and the next exciting opportunity. So really kind of, I suppose, grabbing things and taking them and thinking about, okay, well, how do I make this better? What do I do with this? It really makes your career really rewarding and opens up exciting new opportunities that you wouldn't have even thought of wouldn't even thought of pursuing a couple of years before. You kind of go on this like pathway all that you can't plan for. You just got to let it run.
Do you think that, and I guess it's a little bit of a different experience between being a medical student, being a junior doctor, but as a junior doctor, do you think that they should grab the opportunity if it is available to them, or even seek it out to do a rural rotation?
Absolutely. It would come as no surprise that I say that because I love it. But I think two things. So one is that you might absolutely love it, even if you think you're a city slicker like me, that it might be really great. But also I think it's no matter what, even if you're going back to do cardiothoracic surgery and that's where you really see yourself being, it's a totally different type of medicine working rurally. And I think it can only make you a better doctor getting some of that experience about what the patients that you're inevitably going to be seeing wherever you are in medicine, however you've specialized, you're seeing the same patients that are coming in. They're often if it is that, if it's like cardiothoracics that you want to do, that you've got the patients that are coming all the way in from their hometown. You're dealing with then the rural doctors that you're sending back to, and you're having to trust them with managing a lot of these things when they go back, and having an understanding of the communities, but also then the challenges that face us as rural doctors is really important, I think, for every specialty, no matter where you end up. So I think even if you don't see yourself as a rural doctor, it can only make you a better doctor overall by sort of getting some of that experience.
Aaron, thank you very much for chatting with me today.
Thanks for having me, Peter.